this ever happen to you? You know, you're just leaning over to pick something up, something simple, something light, and all of a sudden your back goes out. Maybe that's exactly where you're at right now, and you're in excruciating pain, your back's seizing up, and you're having a hard time even just standing up. And many of you know what I'm talking about, because that's a prime example of what it is to have a disc injury, a disc herniation, a disc bulge, disc symptoms. So when it comes to diagnosing or looking out, all right, what kind of pain am I having? What could be the potential cause of this? When you have a disc issue, and the most common cause is a disc bulge, so that's where the inner part starts to bulge out and push against that fibrous outer layer, and you get these small bulges of the disc that can actually irritate the nerve root or just get disc inflammation. And symptoms of that, so one of the most common things you'll see is that just all of a sudden your back goes out, it seizes, and then you have a hard time moving around or doing anything. And usually what happens is you throw your back out, kind of feels okay, progressively gets worse, you go to sleep, and then all of a sudden you can't get up out of bed. You're having radiating pain, maybe pain shooting down your arm or pain shooting down your leg. Those are big indications that you have a disc issue. So any type of radicular symptom, radiating pain, but also lack of range of motion. And then the other hallmark to having a disc issue is that your pain is worse in the morning and gets better as the day goes on. And you kind of go through that cycle where it gets a little better as you move more, you go to bed, or you sit for a period of time, and then it's worse again. So those are all prime examples of what it's like to have a disc issue. And if that's you, it's really important that you get it addressed as soon as possible. And realize, too, that this didn't cause your disc issue. The simple bending over and picking something up, those simple things, when you have a disc problem, that builds over time. It takes years to develop a disc herniation, a disc bulge. And so it needs to be dealt with appropriately. And so we're really good at diagnosing different causes, especially disc issues, and then getting it fixed. So if you're in that boat and you know someone that's having similar symptoms, give our office a call. Let us take a look at what's going on. Dr. Ben Ozan, Thrive Wellness Center. We'll see you next time.